Welcome everyone to another wonderful episode here, Jaws Podiatry. The time has come to hopefully make some clarifications on two different subjects. Hi, how are you? We're filming. Thank you. So today we are making two clarifications to the world, two topics of conversation. I got Dr. Kushner here with me today as well. Topic number one, why don't we use Dremels, sanders, high-powered sanders? I mean, I've pretty much heard it all from all of our viewers. The water, device as well, the vacuum, this and that. We'll just keep it really, really broad, right? We'll just say any type of device to reduce callus. Okay, we're going to make that clarification number one. And clarification number two, a lot of people, when we perform our debridements for calluses, corns, why don't we use anesthesia? Without further ado, let's talk about, and I'm going to make this one, I'm going to try my best to really, really make it short, sweet, and to the point. We have done our due diligence, our homework in respect to the problems associated with inhaling toenail dust. Okay, number one. Number two, any type of keratinized tissue, skin, whether it be for, again, we'll keep it kind of broad here, nails, tissue, debridements of skin, using, again, devices, any type of device. What people need to understand, it's very simple. What people need to understand is that the dust of skin, whether it's toenail or actual skin from a callus, will linger, will linger for 16 hours inside the room. What exactly does that mean? What exactly does that mean? Think about that for a second. That for the next 16 hours, there's going to be particles still there. And not only in the room, but also in the office. In every room. Technically speaking, if we think about it, those particles are going to go to the office of the doctor next door, the one in the front and the one on the other side, and maybe the one on top of us here. Okay? That means that if we perform a debridement at 6 or 7 o'clock p.m. on a Tuesday, that means tomorrow morning, we're still technically inhaling those dust particles.
And it's not just the doctor, it's the patient, assistants.
We haven't gotten to that point. We're not even going to really...
It's airborne in the air-conditioned vents.
People have asked me, why not make the investment and put a filtration system? That's not going to happen. It's still not enough. What people need to understand, this doesn't pertain only to our office. This is all of podiatry, all of dermatology, all of the nail salons. This is an epidemic that people are not very mindful of in the moment. You guys don't see that when everyone goes to these nail salons, they don't have a filtration system. They have, yes, of course, they use masks, but these masks are not enough. It's not the N95 mask, right? Which are the ones that they use for outbreaks, for example, right? The ones that you see people with these things. No. And that's what everyone needs to understand, that safety is number one at the top. We, Dr. Kushner and myself, we know of colleagues, podiatrists, that have undergone, they've undergone, surgery for this topic of conversation.
And it's a tough lung disease to battle if you have it.
It's easy for everyone on the other side to criticize, to make recommendations, and so on and so forth. It's easy because you guys are over there, but we're over here. And when safety is at the top, that's what we focus our efforts on. We're not going to go back and forth on this one. This is not going to become a tug of war. What I'm here to say is very simple. At least in these four walls, we will continue to keep safety at the top of everything that we do. Safety first. Safety for the patient, safety for the doctor, and the staff. But education is the key here, because a lot of people they're very quick to say, use a mask, use a shield, use this, use that. Even when we trim toenails, right? There's still dust particles. There's particles everywhere that are just flying everywhere. It's like when someone sneezes, particles everywhere, droplets everywhere. So I hope this makes a little bit of a clarification. First part. Do you want to add anything to what we just?
I just think you need to understand it's not just the doctor or our medical assistant's safety. It's exposing the patient to the same particles. And there's definitely been some documents of patients, nurses, and doctors with a fungal lung disorder that then becomes a long course of treatment, and it's debatable whether it's curable.
Not only that, there's been a lot of cases, aspergillosis, and I mean, I can go on and on. You know, we're not, for all of the viewers, I urge everyone to go to Google and Google what we're talking about, and everyone will see what I'm talking about. It's not 2, 3, 4, 5 articles. You're gonna find 25, 30, 40, 50, 60 articles pertaining to research on this topic of conversation. Number 2, let's talk a little bit quickly on debriding corns, calluses. I briefly I briefly posted a video on a patient yesterday with a very, very large corn callus in between the 4th and the 5th toe. A lot of people also have, going back to the video, the gentleman with the dermatological manifestation, the combination, what we call the leather foot, which basically was the dermatitis with the dyshydrotic eczema, as well as the fungus. And people think that people are quick, they always ask us, well, what about, anesthesia? Why don't, the patient's in pain, use anesthesia? Several things. Some of these patients have opted not to have local anesthesia. That entails an injection or possibly multiple to numb large areas. Local anesthesia, these injections could be a little bit uncomfortable, there's no question. So it's not that we don't recommend it, it's that sometimes these patients, that's what they like, right? That's what they choose. They make that informed decision, number 1. Number 2, pain is a friend to what we do. Okay, I'll give you an example. This patient yesterday that had this large, humongous callus corn. So if we decide to numb that area, we need to know how deep we can actually trim and continue. If the area is numb, we have no idea, right? We have no idea how deep we should be going. That's why I like to stage these procedures. Even when we soak, even when we do this, even when we do that, it's so important that instead of saying, and sometimes, yes, we do, you guys hear the patients maybe in a little bit of discomfort. Of course, it's uncomfortable. The skin has been like that for 3, 4, 5 years, so it's already adapted into the healthy skin underneath. So when it's like sort of pulling the skin. So when we pull the skin a little bit, there will be an element of discomfort. So why don't we numb the skin? Why don't we numb it? Because we use that element of pain to our advantage. We know how deep we can go. We know how much we can take off. So don't think for a second that we're not mindful of that. We know when is the right time and the right place. Dr. Christian.
I would concur with Dr. Wagner that the injection is probably more painful an experience than to shave down a corner callus that theoretically has no pain fibers in there. So I think once the patient initially goes through the first visit and has the initial debridement, when they come back a following session, if they need to, then they realize there's no need for local anesthesia. I could just tell you in my experience that I think what Dr. Wagner's alluding to, you can probably get in more trouble debriding an area that's numb that a patient can't react to, because you might actually remove too much tissue and then create a wound, which is a worse scenario.
Well, anything that we do here at Jaws Podiatry, there's something called the standard of care, and we have to maintain anything that we do here. We have to maintain that in mind. What is the standard of care, and that basically dictates anything that we do. And that's something extremely important for a lot of reasons. You cannot deviate from that, right? You gotta just stay in that straight line. The minute you start moving away from that straight line, that's when you start getting into other major problems. I hope this video has provided just a little bit of clarification, a little bit of clarity to all of our viewers.
And I would just add that a topical anesthetic is pretty ineffective on normal skin because the skin's not absorbing it. Whereas if you go to a dentist and they use topical anesthetic on your gums before they give you the injection, the topical is absorbed, so your mouth begins to get numb from the topical.
Well, not only that, just giving everyone an example, that's in the normal, but even if you apply that on the callus, right? The callus, it's not going to do anything. It's just going to make a big old mess, right? Because it's non-viable tissue, so it's kind of totally pointless. It's going to become just a pancake batter. That's what it's going to become. So anyways, I hope this video has and will bring some clarity to a lot of people out there. We're not in the business to challenge anyone. We're in the business to educate. So if anyone has any questions, please feel free. We come in peace, right? Please feel free to reach out to us via any of our social media platforms, including but not limited to our YouTube channel. I can't wait to post this one. Anything else you want to add?
That's all.
Like always, www.jawspodiatry.com, Instagram, Dr. Tojam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Hope you guys enjoyed this video. Thank you for watching.